In this video we're going to further examine the case of child A, and in particular the questions that Cheshire Police asked Lucy Letby about child A after she was arrested, and the responses that she gave to those questions. So I have the transcript on the screen here, and we're going to go through this, and I will provide analysis when it is appropriate. So I'm not going to read this first bit out. This is just telling you that it's the police interviews that across 2018, 2019 and 2020. So we're starting here with her first interview. This is in 2018, and this is the majority of material that is available in relation to child A, or baby A as the infant is described here. Okay, in relation to baby A, other than the notes, do you remember baby A and your care of baby A other than the notes you've just gone through? Yes, you do. Would you like to tell me exactly in your own words then what your involvement was with baby A regarding around the time he collapsed? So Lucy gives quite a long answer here. So I remember I came on duty. We start our night shift at 7:30 and we have a general handover period which usually lasts until around 8 o'clock. And at that point I went to baby A's cot side to receive individual handover with the nurse that had been looking after him in the day. And I believe this was around 8 o'clock. And at this point the nurse looking after him was connecting or drawing up some fluids to be connected via a long line that baby A had inserted during the day. So at this point, whilst we were getting handover from each other, I checked the fluids with this other nurse and she connected them via the long line. And shortly after that is when we noticed that baby A had gone quite pale and mottled in his skin. Dave Harkness, the registrar, was in the nursery at the time, and we called Dave over and began initiating airway support because baby A was apneic. And then we put out a crash call and Dr. J-Ram came, and then baby A had full resuscitation. So before we go any further, I want to reflect on the fact that this took place obviously in 2015 and she's now being interviewed in 2018, over 3 years later. So I want you to reflect on the standard of her recall and the level of detail that she's able to give. And we'll talk about that later on in the video. So the police say you came on duty at 7:30. Yes. Okay, so what were your actions when you came on duty on the ward? So we have a generalised handover to start with, all the nursing colleagues that hand over from the day shift to the night shift. Okay. So you just have to ignore the way that this scrolls over to the next page. It's not very clear. That's the best I can do. And then I'm not 100% sure of the timing, but I believe I got to baby A's cot side around 8 o'clock to have that individual handover on baby A from the nurse that was caring. Do you specifically remember this shift of baby A? Yes. Okay, why do you remember that? I remember baby A. So do you specifically recall going to baby A's cot side? Yes. Okay, tell us about your observations of baby A at that time. So I remember baby A was on CPAP, which is respiratory support, and I didn't have a lot to do with baby A at that time because when I came to get the handover, the nurse caring for him was already drawing up sterile fluids to go through the long line that had just been put in by the doctors. So we went straight to checking the fluids. Okay, tell me what the support was, the breathing support. Baby A was receiving CPAP. Okay, and at that point, was there anything that alerted you to anything? Even though you can't remember which specifically baby A had, did you notice anything that concerned you with the way he was receiving that treatment? Not with that. The only thing I do remember is that he was a little bit jittery in appearance. He was a bit jittery in his limbs, and that can be a sign of low blood sugars. And he was due a blood gas and a blood sugar shortly after I came on shift. Okay, so tell me what jittery is. Jittery is sort of when the baby is making sort of involuntary jerking movements, their limbs. So it's not in reaction to pain. No, so jittering is something that you recognise as being, it can be a sign of low blood sugar. It's quite a different movement. Okay, is that common? So this is relevant to another case. I won't reflect on this any further, but Lucy quite rightly notes that it is common for preterm babies to be hypoglycemic. Yes, of course that's particularly relevant to the insulin cases. So this is the first 2 pages of 22 that we're going to go through. And I just want to reflect a little bit at this point on a couple of things. Firstly, the calibre of the information being given by Lucy and how clearly she knows what she's talking about and how good her recall is. And secondly, it's very clear that she's being compliant and cooperative. We've seen this in numerous interviews, and we'll see this across all the police interviews that are available. She is as cooperative as you could possibly be, because she thinks, if I sit here and tell the truth, they will understand, they will believe me, and I will be exonerated. Obviously, we know that didn't go very well for her, but we can assess the validity or otherwise of this as we continue. And I'll just say, finally, the police here say, and was that, and then we'll go on to the third page of the transcript. Right, I've had to change the viewing format slightly here because this programme won't easily scroll from one page to the next, and I can't see any easy way to change that. So we'll continue like this. And that's why we were keen, Lucy says, to get the fluids connected, because we were conscious that he hadn't had fluids via his long line in the UVC at that point. Okay, would the fluids have included something that would aid the jitteriness? Yes. Okay, and what was that? I'm not sure without looking which fluids we connected, whether it's 10% glucose or TPN. Okay, so tell me who the nurse was that you took over from. Melanie Taylor. Okay, what was her handover to you? This is from memory. I can't remember specific details. Okay, but I don't recall there being anything of any due concern. Okay, so when you came on duty, how was baby A presenting to you initially? From what I remember, I didn't have any concerns other than this jittery movement. Okay, do you remember how long into your shift that he became jittery? No. So you said that you checked the fluids with the other nurse. Is that again something that you specifically remember with regards to baby A? I can't remember which fluids, but I know that Mel was there with the fluids when I came to get a handover, and we made that a priority to check the fluids and get those set up and running. Okay, again, why was that? Why was that a priority? Because he hadn't had his cannula, his peripheral cannula, inserted in the day. He'd had a UVC that they weren't happy to use, and he'd had a long line inserted that the doctors had confirmed we could use, so I think he'd gone a few hours without any fluids. Okay, is that normal? Is that a cause for concern? It's not ideal, but when you have new babies and you can have problems with obtaining access to be able to give fluids. Yeah, right, okay. But there was nothing that gave you any concern apart from the jitteriness? No, not that I remember. At the point of handover, no. Okay, so you said he became pale and mottled. Is that during the handover with Melanie? I think it was after we connected the fluids. Okay. He was normal in appearance when we were having handover, and once we connected the fluids, it was noticed that his colour changed. Okay, so with regards, again from memory, yourself and Melanie, did you do that together? I think Mel was drawing up the fluids and Mel was sterile because you have to do it aseptically, connecting fluids. So I believe she was gowned up and setting the fluids up, and I checked the fluids with her because two people have to check any bags or any fluids that were running. Okay, and then I think from memory Mel connected the fluids to the long line. Okay, so what? And then we set up the pump together, the infusion pump. Okay, so physical interaction that stage with baby A, what exactly did you do? I don't, in layman's terms, I don't recall having any physical contact with baby A at that point. Okay, so when did you have physical contact with baby A, do you recall? No, I think it was when he deteriorated. Okay, do you remember what you were doing just prior to the deterioration, Lucy? Where you were? I think I was at the bedside checking the equipment, so usually when we have received handover, we'll then go through and check all the emergency equipment. Right, check any infusion pumps, any ventilator support, you check all the equipment, check your incubator, those sort of things. So that's page 3 and page 4. Now, what I want you to reflect on at this point is, does this seem like a guilty person being interviewed? Is the way that she's answering these questions indicative of someone trying to cover her tracks or someone who is likely to be guilty? So we'll continue because Lucy continues to give an account of what occurred. She continues to answer the questions. So we'll continue with those questions, and I will butt in with some analysis when it's appropriate. So the police continue. And were there any issues with the equipment at that time? No. So I think this question is quite revealing, actually. So we've seen in previous analysis that I've done of various things that the police have said in the Operation Hummingbird promotional film. I nearly said documentary then, it's not a documentary. And in the Netflix documentary, let's be generous and describe that as a documentary. They make various comments. And one of the comments that they make several times, we've seen this across multiple fora now, is this idea that Lucy needs to give an explanation, or there needs to be some sort of unifying explanation. We see Paul Hughes talk about a bad bug in the water. So what they're looking for here is like some equipment malfunction that could explain something in their simplistic world where there has to be one unifying explanation for everything. So that's why they're asking about equipment failure. So that if Lucy could then say, oh yeah, all the equipment was malfunctioning, they would say, wow, we didn't realise that. Obviously, they would have double-checked it. They'd have found out, it was untrue. But they're looking for such a kind of crude explanation for what occurred. Because they just don't have the intellectual level to be able to understand this. Obviously, they don't understand the medical information and the medical aspects of the case. But they can't even understand the basic notion. Paul Hughes, in particular, has indicated that he can't understand that there can be a bad bug in the water and there can also be someone engaging in deliberate harm. Those two things are not mutually exclusive. I've mentioned this several times previously. Or alternatively, it can be lots of nuanced reasons that is exactly what occurred. It's the kind of complex clinical picture that would occur in relation to these infants that Paul Hughes described as medical jargon because he doesn't understand it. So let's continue. Okay, and that's where you were just before he became unwell. Yes, I think so. Was anyone else with you at that time? So Mel was still in the room and a registrar, Dave Harkness, was in the room with baby B. Okay, what was Mel doing, do you remember, at the time? No. Okay, were there any other babies? I think she may have been writing her notes, but I'm not 100% sure. Right, were there any other babies in the room at that time? I know baby B was in the room. I'm not sure about any others. Right, who was baby B's nurse at the time? I think it was Caroline Benyon, but again, I'm not certain. I know Caroline Benyon was there because she became involved once baby A deteriorated. I'm not sure if she was on the day shift or the night shift. And you say Dr. Hartness was there? Yes. What was he doing then? He was doing something with baby B. I'm not sure. I just remember him being at the incubator. So we're going to look at what was actually occurring with child A at this time, and you'll see how accurate what Lucy has said actually is. So I'm going to go through a discussion of where the nurses were, where the babies were. This was agreed by the prosecution, it's agreed by everyone. So when this occurred in court, they were shown the video. I've shown another video that goes through a tour of the neonatal unit, and I'll show some extracts, a couple of images from that in this section. But there's another video that's still on the independent YouTube channel that shows Nursery 1, which we've seen before. And then there's discussion here. So as the video you were going in, the first on the right-hand side door, the first door, baby B was on the far right side. Would it help if we play the video again? And I think so we can just lay out the geography so that we've all seen, because we are only seeing it from here. There are clearly two doors from the corridor into it. The camera goes in first through the door on the right and pans around. And we can see on the right is one behaviour, then there are two more in front. And there's a partial separation into the next door room. So it comes out of that door, and so Judge Goss goes on. And there's some considerable discussion, and they conclude that right-hand incubator 1, next one along 2, 3, and the left-hand side 4. Baby B, I think, was in incubator 1. Baby A was in incubator 2. So this is all agreed. It's agreed by the prosecution. Then there's some further discussion about exactly where baby A and baby B were. And they're saying, in any event, when you describe the position that you were in and the computer and looking across, the incubator was in is the one we can see on the right-hand side on its own below 5.5 metres. Is that correct? That's baby B, and baby A is, sorry, to the right of where it says 8.6 metres because they're looking at a floor plan. I'm going to show you this in a second, and you'll see all the distances. She then is made clear that there's a direct line of sight to baby A from the computer. The location of the nurse was confirmed by computer records where she is, and saw from the monitors above the incubator she was deteriorating. And then there's further discussion of where baby A was, how they knew there was a problem with baby A, what alerted Lucy to this problem, etc., etc. I think this is another nurse being interviewed. When you're sitting in front of your computer, you can see the incubator that baby A was in. So I have a sort of direct line, visual line. Although he's not right next to me, I could see that he started to deteriorate. So his heart rate dropped and his saturations dropped, and Lucy Letby was standing by the incubator. So this nurse is standing right next to Lucy Letby. She's got a direct line of sight to Lucy Letby while this is happening, while the deterioration is happening, while what is considered to be the key incident in this infant is supposedly taking place. And then there's some further discussion about the incubators being movable, but this is all meaningless really because the position's already been established. Dr. Hartness agrees with the account of where the cots were and says it was likely there were only 3 incubators in the room. So Dr. Hartness talks about where child A was, where child B was, and so on. And then there's just some further discussion. Dr. Hartness saying, from what I remember, there were just the 3, but I can't be 100% sure, but that corroborates what everyone else has said as well. And then Caroline Benyon is interviewed as well. You may remember Lucy made reference to Caroline Benyon, and I'll just read this a little bit here. Again, where were you when you first became aware that there was a problem with baby A? So from reading my statements, I was in the same room as baby A, but I was next to baby B, probably because the babies were HDU, ITU requirements, so a little bit more intensive. I would have probably still been doing my checks, checking baby B over, checking her heart rate, breathing, completing my observations and just making sure that all safety checks were fulfilled. Mrs. Benyon say probably is that based on the times or based from an actual memory of the events. I do remember being in the room, and also that correlates with the time of the event as well, that I would have been in the room. So it's not disputed that Lucy Letby was by the incubator. This was a designated infant. So what that all adds up to is the following picture. So this is Melanie Taylor here. This is the registrar, Dr. Hartness here. This is Lucy here. And this is Caroline Benyon here. So you can see the measurements here, 8.6 metres across the entire length of the room, 5.5 metres here. I'm going to show you some further images of this in a second. But I've calculated using Pythagoras' theorem that Caroline Benyon would be no more than 4.3 metres away from Lucy Letby. And we've got Melanie Taylor here, who is possibly closer. We don't have the precise measurements here. It will be similar, a similar distance, approximately 4 metres. She's slightly closer laterally. She's probably slightly closer. She's probably slightly closer looking at the measurements here. So they're both within metres of Lucy Letby in the same unit at the same time, with a third person also in the unit at the same time in nursery 1, which is not very big anyway. So you can see here, this is the station. This is where Melanie Taylor was. And you're going to see the other, she's literally just feet away. It's not even really, you could describe it as metres. She's probably the length of 2 human beings away from Lucy, perhaps less than that. And you can see Lucy would, if you imagine on the left-hand side of the picture, the nurse's station is roughly here. So a few feet away. And the child that Lucy was caring for would be roughly here, where this blue chair was. And Caroline Benyon would be a couple of feet back from where this is being filmed. So you imagine these 3 people in proximity, and then Dr. Hartness is over here somewhere, near where the this laptop, it looks like a laptop or maybe some monitor, but similar sized screen that you'd have on a laptop, is located. So we've got Melanie Taylor here, we've got Dr. Hartness here, we've got Lucy Letby here, and then a couple of feet back from this, we've got Caroline Benyon. Now there is absolutely no prospect whatsoever that the events that were recorded in court have happened, obviously. There's not even the slightest chance. Frankly, I don't know how the jury couldn't see this, because it was made clear to them, the events were made clear, they were shown a video, they were told the positions, and they just couldn't see that it would be logistically impossible. That even if it was logistically possible, you would never take that risk, even if you genuinely wanted to harm babies. There's 3 people around you. It's absolutely insane that this is... Lucy Letby is facing a life sentence over this. Leaving aside all the medical problems with this conviction, just look at the logistics. So I'll return to the transcript. We've reached the highlighted section here. Okay, so you've done those kind of connections. You didn't have any concerns at that stage. How long between doing those and you noticing baby A become pale and mottled? It was fairly soon, within minutes, I think. 30 minutes? 2 minutes? I don't know, maybe 5 minutes. Okay, something like that. And Melanie had moved on to doing her notes. I think so. And you were doing the check of the equipment. Yes. Okay, so tell me how you interpret pale, first of all, in a neonatal baby. It's a loss of colour. Babies are usually quite pink, and he'd become more pale, as in almost white. Okay, what does that mean to you as a nurse in that field? That there's something wrong. Okay, like what? It could be an infection. Okay. Could it be that they are hyperglycemic, that they've had a sudden collapse? Okay, and mottled, the same thing. How do you interpret the mottled appearance? So mottled is a bit more of almost like a rash appearance, like blotchy red marks on the skin. Okay, is that a reflection of something in your experience? Again, it can be a sign of infection, low blood sugars. If they're cold, they can become mottled if they have poor blood gases. Okay, and exactly what is mottled? What is a mottled appearance? Yes. So when the baby's quite pale and white, they can have sort of red areas on them. Red. Yeah, like reddy purple, yes. Okay, was this specifically with regards to baby A, was it localised or was it spread out? Where exactly did the mottling appear? I think it was his hands and feet. Okay, and he was centrally pale. Okay, so those two together, considering how he presented to you at that time, what were your actions then? So I think I went to him and checked him and found that he was apneic and not breathing. So we'll just pause there for a second. I'm not sure if the police returned to discuss this mottling further, but I just want to reflect on the mottling for a second. So with regard to mottling, I've mentioned previously that I've interviewed a vascular surgeon for my book, and he told me that anybody who is undergoing a circulatory collapse will become mottled, and that mottling can take a range of appearances. So you will see that quote in my book. Backing this up was Dr. Jane Horden speaking at the Thirlwell Inquiry. Of course, she's the neonatologist who examined the infants, and she told the Thirlwell Inquiry in November that I was surprised that he asked about mottling because it is such a common finding in babies that are unwell, and we were sadly talking about babies who were unwell. But I'm going to break this mottling down further for you. So just to go over mottling as well here briefly, I could go over all these links, but I want to deal with this relatively quickly. Mottling is a sign of poor perfusion / circulatory failure. Mottling is a common sign of cutaneous hypoperfusion. Mottling is the clinical expression of skin hypoperfusion. Mottling correlates with reduced skin blood flow. When circulation fails, shock or collapse, blood is not adequately delivered to the skin. This produces mottling. It's a common thing, as Dr. Jane Horden has just explained. It's well recognised in circulatory collapse states, e.g. shock. Clinical literature notes mottled skin has been recognised in acute circulatory failure. In septic shock specifically, mottling is common, associated with severity and mortality. Mottling is not incidental, it's a classic bedside sign used in critically ill patients with circulatory collapse. And this mechanism explains why it varies in appearance. Mottling arises from reduced blood flow, microcirculatory dysfunction, vasoconstriction, and endothelial dysfunction. Studies show different mottling scores, changing appearance as perfusion worsens or improves. Because it reflects unstable microcirculation, mottling can be patchy, marbled, or diffuse, can worsen, improve, or fluctuate, and can look different between patients. Now, there's something I think really important to note here. not only does this meet all the characteristics of everything that is cited in the Lucy Letby case, but also it seems very odd that the paediatricians and consultants on the unit couldn't recognise this, because Dr. Jane Horden almost hand waves it as being of no significance whatsoever, and yet it's obviously been cited as significant by the consultants, and then that's been passed on to Dr. Evans, and now the police are asking Lucy about it. Now, of course, the police couldn't possibly do a modicum of research required to find out that mottling is common. They just accept whatever Dr. Evans tells them to do, or tells them. So when Dr. Evans says, don't bother with any other experts, they just do as they're told. When Dr. Evans says, oh, you should always be able to tell why a neonate has collapsed, they just believe him, then repeat it on TV, and so on. So no further investigation went into this mottling, but in actual fact it's just a very common aspect of circulatory collapse, and Dr. Horden has indeed acknowledged this. So we'll return to the police interviewing and questioning Lucy Letby from here. Okay, so those two together, considering how I presented to you at that time, what were your actions then? So I think I went to him and checked him and found that he was apneic and not breathing. Okay, so how did you check him? What do you mean by check? I looked to see if he was still breathing and if the CPAP mask was in place still and the machine was running. And was it? Yes. Which machine was running? The CPAP machine. Okay, yeah. And then straight away Dave was in the room, Dave Harkness, and I called him over from what I recall. Okay, how did you have to almost stimulate baby A or physically check him? I think so, but I can't remember. Okay, so you say that you saw he wasn't breathing, that he was apneic. Yes. So tell me how that presented in baby A. How did I know that he was apneic? Yes. I think I went over and assessed him. He wasn't breathing, and I'm not sure what his observations were doing. I can't recall his observations at the time. Okay, at that time, was anyone else with you? Yes. Dave Harkness was on the cot side next to him. I'm sure Mel was in the room, and Caroline Benyon. So Dave Harkness would have witnessed the apnea. The breathing had stopped, yeah. I'm not sure that he was looking at baby A at the time, but he was in the room. So how did he become aware that baby A was apneic? We called him over. Okay, who's we? I'm not sure whether it was myself or Mel and Caroline. Myself or Mel or Caroline, rather. Okay, I'm not sure who. We were all in the room, from what I remember, which is agreed. So I'm not sure which of us who I called for first or how we were all in close proximity. Was he attached to any monitors? Yes, he would have been attached to a Philips monitor. Okay, so in baby A's case in particular, did the monitor go off? I can't remember. Right, specifically. Was it the monitors that attracted you to baby A being apneic, or was it your visual observations? I can't recall, but I would assume it would be the monitor. Okay, so had you moved away from baby A after you'd done the handover? I can't specifically, I don't know. Right, because you said you were checking if the equipment is adjacent to the cot side though, were you with baby A throughout that period? I believe I was checking the equipment, yes, at his cot side and his charts. When you talk about this mottled rash, can you give us any further description of how it showed its shape? I think from memory it was more on the side that had his line in. Okay, which side was that? Do you remember? I think it was his left side. Okay, and you described it as a red-purple colour. Can you sort of help us with any comparisons with anything colour-wise the way it showed? Was it bright red? Was it dark red? I think it was more pale than the mottling, than the little areas of mottling. Okay, but predominantly it was his paleness. So obviously the reason they're asking about this is that Dr. Evans and the consultants have made a big deal out the mottling and made a big deal out the discoloration. So now they feel they have to ask Lucy about it. I don't know what they're expecting Lucy to say exactly. Obviously they're just trying to catch her out in some regard. We should bear in mind that Paul Hughes said in the Daily Mail podcast that he'd basically decided that Lucy was guilty by this point. This is 2018. She's being interviewed. And they've arrested her. In the documentary, Simon Blackwell claims, we had no choice but to arrest her, which is obviously untrue. So the reason they're asking these questions is because they have been told the mottling is really significant. So they want to see what Lucy Letby says about it. So in case she says anything incriminating, I can't imagine what she could possibly say that was incriminating, considering mottling is a common feature of circulatory collapse. but that's why they're asking these questions. Okay, but predominantly it was his paleness. Did anyone else see that mottling on baby A? Yes. I think it was still there when I called Dave and Caroline and the other nursing staff came in. Did they say anything about it to you? Yes. We were advised to stop the fluids on the long line straight away. Did they say what they thought it was? I think Dave mentioned that it could be potentially an issue with the line, so to stop the fluids. Okay, how does a long line cause mottling? If the long line wasn't in the correct position, you were running fluids, and it was going outside the bloodstream into the tissues, then it would cause circulatory problems too. Okay, right, that limb or that area. Okay, who had inserted the long line? I think it was Dave Hartness. Doctors insert it, so it would have been a member of the medical team. Okay, and that was prior to you coming on duty, I think you said, didn't you? Yes. So that was already in situ? Yes. Okay, at 20:05 you put 10% glucose commenced via long line with S.N. Taylor as agreed by Registrar Harkness, who was present. What was this for? All the babies that aren't being fed need to have some fluids running to maintain the blood sugars. So 10% glucose is the standard formula we would give for TPN. So baby A was commenced on obviously 10% glucose. Okay, and if we move along there, I think we've covered. You noted him to be jittery, that he was due to have a blood gas and a blood sugar taken. I think you mentioned that to us, didn't you, that we went through the process of that. How was baby A handling at that time? I don't recall handling baby A. Right, at all that day? No. Okay, so you've put there at 2020, baby A's hands and feet were noticeably white, centrally pale, poor perfusion, baby A became apneic. So you put there the baby A became apneic at that time, his hands and feet were noticeably white. So was that the correct sort of way displayed his hands and feet were white, you saw them being white and then he became apneic at the same time, or was that afterwards? I can't recall specifically. But was anyone else present when you saw those? There were other staff present in the nursery, yes. I remember raising about them being white. That's when I was advised to stop the fluids. At that time, yes, I believe when I was called for help, yes. Okay, so where you've put centrally pale and perfusion, the poor perfusion refers to how you described around the limbs, yes. The extremities, okay, yes. Okay, and that could be caused by a problem with the long line, yes. So that's the same thing, yes. Okay, what do you mean by perfusion then? What's perfusion? The circulation. Okay, was there a reason why it's particularly poor with baby A? No. In your opinion, no. Okay, then you've got Registrar Harkness in the nursery and assistants called for, so I take it he was there pretty straight away, was he? Yes. And that was his initial advice to you. Sorry, what was his initial advice to you? To stop the fluids. And then shortly afterwards, quote, no heart rate was detected and full resuscitation commenced as per medical notes. Do you want to just go through that process of the resuscitation for us then, specifically to baby A? Okay, I can't remember specifically my role with baby A. Right. Is there anything else at all that you do remember about the resuscitation? No. Then sadly, baby A passed away at 20:58 hours and was given to the parents to cuddle. How were you feeling about that? It was awful, really. So we'll just pause at this point because I do think they go into the medical aspects of this case again, but also they spend a bit of time talking to Lucy about her emotions and about the aftermath of this incident. So what I want you to reflect on is the way that Lucy gave answers, because we're going to go over what the panel said in regard to child A, and I want you to know how accurate the account of Lucy Letby was when compared to the account of the panel. So I will read to you the panel's account, and we could go into more detail than this, but this is an excellent summary of child A. Child A was a 31 week and 2 day, 1.66 kilogram birth weight, twin 2 male infant who was delivered by emergency caesarean section for maternal hypertension. Mother had antiphospholipid syndrome and gestational cholestasis, not charted in medical records. At birth, child A required resuscitation but stabilised. The next day at 1600 hours, the intravenous peripheral line tissued and IV fluids were stopped. An umbilical venous catheter was inserted but replaced for malposition. A long peripheral line was inserted at about 1900 hours. Fluids were reinfused at about 20 100 hours. Soon after, he suddenly became pale, poorly perfused, apneic, and desaturated. He was intubated, resuscitated, and received 7 doses of adrenaline, but no blood gases were done during the 30 minutes of resuscitation. His heart rate dropped and small ECG complexes were noted. Skin discoloration with blotchy patches of brighter pink on a blue-grey background was observed. The infant did not respond and treatment was withdrawn. Now you can see from that how accurate Lucy's recollection was of this infant. Her account was, I'd say, almost exhaustive, you could describe it as. It's entirely accurate and actually obviously much more detailed than that passage is. But she really remembered pretty much every detail that you could possibly wish for in chronological order and even accurate around the times that things happened. Now, I want you to bear 2 things in mind in relation to this. That's in addition to the fact that this is obviously indicative of someone that's telling the truth. The first thing is, remember the idiot Danielle Stonier, and I make no apologies for calling her an idiot. Remember that she said, Lucy would give really quick answers when asked about general nursing practice, but then she would pause when asked about specific incidents on the unit. That's already a stupid statement anyway. We've already been over the reasons why that's a stupid statement. The reasons are obvious. This is because this occurred 3 years ago. Over 3 years ago. But you can also see from this infant, Lucy gives an almost flawless account of the events that entirely matches what these absolute top-draw neonatal experts say. That's the first thing. The second thing I want you to remember is she's been dragged out of her house. She didn't know she was going to be arrested. Incredibly stressful situation. She's sitting there in the cells waiting to be questioned. She's never been in this position before. She's there with the police. She knows she's facing life sentences. She's under enormous stress and enormous pressure. And then look how strong the account she gave under those circumstances were. Now, if you had any sense of discernment, you would know that you were dealing with an innocent person at this point. And then I just want to point out as well that I encounter people in the comment section of my videos saying, have you seen the transcripts? Have you seen the transcripts? Sometimes just to indicate their intellectual level, they'll say, have you heard the transcripts? But anyway, they will say this to me all the time. And, I rarely respond, but sometimes I do. But yes, I've seen a lot of the transcripts. My question would be, how did you hear or read these transcripts and conclude that they point to guilt? Like, do you have any critical thinking ability at all? We know Cheshire Police don't have any. That's very obvious. But do you have any? So we'll continue with the transcript of Lucy answering questions. Then, sadly, baby A passed away at 20:58 hours and was given to the parents to cuddle. How were you feeling about that? It was awful, really. Can you explain what was going through your mind? Just how quickly it had all happened, and I didn't have a relationship with the parents or anything. And obviously they came, and baby B was in the room at that time. And we were conscious that we were split between 2 babies, and baby B was present when this was all happening as well. Do you know who gave him to the parents who passed baby A? I think it was myself. You think or you remember? No, I can't remember specifically for definite. What made you think it might be you? Usually it's the member of staff that has cared for the baby, that's assigned to look after the baby, that would have that role. It must be a very difficult time for you, yes. How do you sort of deal with that? What's your sort of coping mechanism for that? I think we just all, as a team, sort of supported one another with it. Do you remember any sort of debriefs or chats with... There was a debrief, a few days later, I think. I'm not sure of the exact date, but there was one held formally. You remember that, do you? Yes. Who was involved with that? Who was present? I think it was led by Dr. J-Ram. I can't remember any of the specific details about it. Was there any particular outcome from it all? No. I believe there was some mention that Mum had various health issues that were being looked into, whether they could have affected baby A and baby B, but I don't recall anything else. Obviously, we know that this parent had antiphospholipid syndrome. We don't know what they looked into or what inquiries were made and what conclusions were drawn exactly. What about offloading to friends or family, after your shift? Did you do any of that? I can't remember specifically, but I would have told my parents and my friends yes. But you don't know specifically? No. Okay, up to baby A, had you had experience of babies passing away professionally prior to this death? Yes. Okay, what kind of occasions were they? In what circumstances? I'd seen babies pass away at Liverpool Women's when I was doing my training there, very preterm babies. Okay, and we lost a 23-week baby on the unit when I first started, so I'd seen that baby. Okay, is there sometimes an element of a death being expected within the neonatal unit? Sometimes, yes. Okay, depending on the baby's condition and gestation and things, yes. With regards to baby A, was his death anticipated or expected? No. My concern at the time was whether there had been any issue with the long line, because it was sort of in a few minutes after we connected the fluids that he seemed to deteriorate. So I think my concern was that there was an issue either with the line or the fluids that we connected. Okay, so you explained about how the long lines can be in the wrong position and that can cause problems. So that was your concern with the long line, is that correct? Yes. So let's remember again, this is stuff that was cited by the panel once more. Okay, what were your concerns about the fluids that had been administered and could cause a collapse? So I didn't have a concern specifically about the fluid, but when thinking of what could have caused it, my concern was maybe that the bag of fluid wasn't what we thought it was, potentially. Okay, what did you think it was? 10% glucose. Did you say that Melanie attached it, or you just don't recall who attached it? I believe Mel was sterile, so I think Mel would have attached it if she was sterile. Okay. She would have been the one to have connected it. I can't remember for definite who connected the bag. No. Where does the bag come from? So the bags are all pre-sealed, and they were in a cupboard in nursery 1. So who actually retrieves those out of the cupboard? The nursing staff. Okay, so did you retrieve that bag for baby A? No, not that I recall. I recall that Mel had already had the bag out, okay, and already had the line ready to run through, so we checked the bag together. Okay, as part of your checks of his equipment, did you recheck his bag and the long line after Mel had attached it? I can't recall specifically. Would there be any record made of who attached this bag? So usually when we sign the drug chart, the signature that signed first is usually the person that connected, and the signature below is the co-signer. You then get on to say that, quote, the hand and footprints were taken with consent, along with a lock of hair. Hand and footprints of sibling also obtained as per parents' wishes. Parents and maternal and paternal grandparents have had time alone cuddling baby A. Baby A has also spent time on CLS with parents on cold cot. Photos taken with unit camera and parents' phones. Do you remember who did those activities? I believe I did. The footprints, I remember doing those for baby B. Can you go through the process of how you would do that? We have a kit on the unit that has a set of paper and wipes that we wipe the foot with and then imprint that onto a piece of card. That's usually done with 2 people. We do it with the hand and the feet. Okay, obviously a very difficult, baby A's passed away and you're doing that. How does it make you feel doing that process? I personally find that process it's quite nice to do something nice for the baby and with the baby, and I see it as a way of giving parents memories. So we're at the end of page 13 of 22 now. So we're just over, we're approximately 2/3 of the way through, in fact. So this is, I guess, is all looking for incriminating information. I guess that's why they're asking the questions. None of this has any particular relevance to the allegations. So we're actually nearing the end, I believe, of her 2018 interview. So I'll just continue. I didn't have any real particular comments about that section there didn't appear to be any particular relevant analysis. So I'll just continue and we'll see what comes up in the next section. Okay, where do they take place? Where do you actually do this? I can't remember specifically where we do it, but you can either do it in the incubator or after the baby's passed away and it's on the cold cot. We can do it in there. We can do it when they're sat on the mum and dad. I'm sure that's not a correct transcription. We can do it wherever, really. I don't recall specifically where I did baby A's. And who is present when this occurred? Anybody can be present. So if the parents can be there, we usually do it with 2 members of staff for the practicality of having somebody to assist you with the paper and the wipes. So it's usually 2 members of staff that do it. And what the documentation that you referred to in those notes, what is that documentation? So when I spoke to Lulu, the solicitor who's been on the channel, one question I asked her is it legitimate for Lucy to ask questions of the police? So what I would be asking under these circumstances, why are you asking me all these questions? None of this has anything to do with anything, really. This is just procedure for after an infant has passed away. Why am I being asked this? What relevance does this have? I don't really understand. Obviously, I know now as well, because Lulu has told me that really, essentially, what you should do is not comment at all, and then give them a written statement. That may not have helped Lucy, but it certainly wouldn't have harmed her. So these are things she didn't know. A solicitor hasn't advised her. We will see a very small interjection by a solicitor shortly. But why is she being asked to go through all these things? So these never appeared in the court case, because how could there be anything incriminating, or how could there be anything untoward about Lucy doing things for the parents and so forth? There were a couple of things used against her, but none of in terms of that, like, oh, she was unusual, she was too keen to do this, she was too keen to do that, her demeanour. But she can't be criticised for going through the standard procedure of what anyone is supposed to do on the unit when an infant passes away, to try and reassure the parents. So why the police would ask about this, I don't know. They're obviously looking for an inconsistency in her account, which is why they ask. We've seen in previous transcripts, they ask about the confession note. They ask about that on the first day, very first thing she's asked about virtually, and then they ask her about it again on the second day of arrest. Then they ask her about it again in 2019. Then they ask her about it in 2020. So when in that Netflix documentary they show Lucy saying no comment, the police know very well she's answered that question. Not once, not twice, not 3 times. So that was incredibly deceitful of them to suggest that Lucy was avoiding that question. They know full well that she didn't. Obviously, I mentioned that in the Netflix film as well. But all they're doing with these questions is, again, trying to find an inconsistency or trying to get her to say something incriminating. But we'll reflect on that further as we continue. And what? The documentation that you refer to in those notes, what is that documentation? So we have a bereavement checklist that we have to go through when a baby dies. So we tick things that we've done, such as take hand and footprints if photographs have been taken. Is the baby labelled? Do parents aware of things like that? And that's passed over then to the staff taking over, and they continue that sheet. Okay, is there a reason why you refer to them as mummy and daddy? Can you see that within those notes? Because they are their mum and dad. This is kind of the level of questioning. Okay, obviously some people call them by their names or parent of, but the reason why usually we would refer to them as mum and dad or parents. We don't usually name them by their Christian names. Okay, then you put mementos gathered and placed in a memory box. Why was this done? That's what we do for any baby that's passed away. I mean, this is tragic to read, really, because Lucy's just thinking, if I answer all these questions honestly, if I show I'm a competent nurse, if I show that I'm being cooperative, if I show you that I know the policies and procedures, if I show you that I've remembered what happened with this infant, you will understand that I'm telling the truth, because you're the police, so you're supposed to be intelligent people, and then I will be exonerated on that basis. We have a set bereavement box with various mementos in it, and that's what we would put things like the hand and footprints and items from their cots, such as their cot card, their name bands. What about the family? Did you ever keep in touch with the family after baby A died? Only whilst baby B was still a patient on the unit. Did you make any other notes through the course of caring for baby A? Did you make any other notes before you placed those onto the system? I don't recall specifically with baby A, but quite often we would have a handover sheet where we would write down information about the baby, and if he was having a resus event or anything like that, you might make notes on the back of your handover sheet to use at the end of the day to help with writing your notes. So let's make note of this. Lucy raised the handover sheets, so she volunteered that information. So if she thought the handover sheets were significant, she would be shredding them. Firstly, we've discussed this many times, but she certainly wouldn't raise them in a police interview if she thought, oh, I've got handover sheets in my house and that will be used against me. as incriminating evidence. She would hardly say we would have a handover sheet and bring it up in the interview herself, would she? So the interview continues. Okay, you know the notes that you do make, handwritten notes that you make, like you say, for the purpose of handover, what happens to those at the end of the shift? They're usually disposed of then in confidential waste. Right, okay, what do you do with yours? What did you do with baby A's in particular? I don't recall. How do you actually get onto the unit? Is swipe access right to gain entry to the unit? You can imagine them there going, oh my god, we've caught her out. Aren't we brilliant investigators? She's got a handover sheet, and we asked her what she did with it, and she said they're supposed to go in confidential waste, and she didn't know that she had a handover sheet for baby A. Aren't we amazing? Haven't we done an amazing investigation? Aren't we geniuses? So let's continue. Okay, are there any particular times where you would work more overtime or times where you wouldn't want to, Do you have set holidays throughout the year? No. Okay, you don't get a call like last minute, we're short of staff. Yeah, you do, yes. How often was that? Quite frequently on a sort of week-to-week basis, I would say. So what sort of notice would you be given for the overtime? I mean, sometimes they would call you in the morning and say, can you work tonight? Or ring you today and say, would you be able to work tomorrow? Do you remember anybody else giving baby A care in between the time that you had the handover and the point of his collapse? I think you said at about 8:20. No. Okay, obviously you've had his notes. Having read his notes, do you think there was anything that you need to raise for us to have a look at during this interview now with regards to baby A that you feel we need to discuss? No. Then Miss Letby's solicitor spoke. The thing is, in relation to baby A, I think you've only had less than 20 minutes contact with him in total. Is that yes? And then reverting to the officer, yeah, including the parents, ever, yeah, that was the first time. From the time of coming on duty to the time, that was the first time I've met baby A, yes. So within the 20 minutes that you had, so very important to emphasise before I go any further, baby A was deteriorating before Lucy had contact with the infant. We know that for a fact. Everything was wrong about this infant in court. Everything was presented incorrectly, as we've already heard in recent interviews, as we've already heard when Dr. Martin Pittman spoke about the background, the obstetric background to child A and child B, as we've already heard in other interviews. The court heard this infant was perfectly well at birth. That's not true. The court heard that Lucy Letby's actions were to blame for the collapse of this infant. That's not true because the infant was already deteriorating before the very small period of time that Lucy Letby spent with this infant, during which time there were other people around her. And the key allegation must take place during this period of time, because if it's an air embolism, if it's a deliberately administered air embolism, then there has to be a rapid collapse. Indeed, Dr. Evans cited that as being one of the critical diagnostic factors in his so-called diagnosis. So I'll just finish off this bit of the 2018 interview. So within the 20 minutes that you had, he's gone downhill, he became pale, you saw this mottled effect on the feet, apneic, stopped breathing, collapsed. Then obviously a full resuscitation attempt was made. Is that a fair sort of summary of what happened with baby A? Yes. Not only is it a fair summary, it's an accurate, very accurate summary. Is there anything else you would like to tell us about baby A and your care for baby A that can help us with this investigation? No. So the only concern that I had was there was an issue, potentially with the line or the fluid that we'd attached. Okay, and again, we've spoken about the line, the potential problems there was, that it was wrongly located and whatever was put through the line would seep out the bloodstream. Yes. Yeah, and the other potential problem there is the bag and whether it contained the correct prescription. Yes. So we've seen there a very fluent interview from Lucy Letby. Notice that she never says no comment. Notice that she answers all the questions. Notice that her account of events is entirely accurate. So I'd like to do a little exercise in examining this 2018 interview. So I had a bit of a conversation with ChatGPT and explained the context of what was occurring and gave some background information and provided the panel's opinion and told the learning language model about the time frame involved, which of course is over 3 years after the events. And the model came up with this scores of 7 out of 10 for transparency, 8.5 out of 10 for compliance, 8.5 out of 10 for cooperativeness, and 7.5 out of 10 for credibility, likelihood the account is broadly truthful. So I think those numbers are quite low. Personally, I would put them all higher than that, because I think this model cannot really understand the nuances of human behaviour and so forth, although it is still an impressive technical achievement that it can analyse language so quickly. The fact the interviewee's version aligns with an independent expert summary on the central mechanism is strongly in her favour and makes the account look materially more credible. So the language model here indicates hedging and memory limitation language. So that's something Daniel Stonier cited, that she couldn't remember specific things, but I think that's extremely unfair when this was over 3 years ago and, of course, is a stressful situation. I didn't ask ChatGPT to try and take into account the fact that it's a stressful situation. I'm sure that these numbers could be revised up further, but it would be even this crude experiment that I think comes out really lower for Lucy. These numbers are lower than they should be, really, but it still indicates, 75-80% likelihood, even here, that the account is broadly truthful. So it's against the odds that Lucy isn't telling the truth. But I mean, I think really the percentages should be much higher than that. But I just thought it was an interesting exercise to go through, that even a model such as this, which is probably leaning this way as well, because the model probably recognises that this is Lucy Letby being interviewed, and it's been programmed not to say anything too controversial, such as Lucy Letby's innocent. You'll find that when you use ChatGPT, it's very reluctant to do anything that could be criticised now, because it has done certain things that have been criticised. So it's always erring or leaning towards the side of the system, the verdict, the status quo. And even then you can see that it is saying that Lucy's giving a very truthful account. So given that the police have all this context, and the police have more context, and the police have a human understanding, etc., etc., the police should have been able to see that this was a truthful account, and that Lucy was being compliant and helpful and transparent. So just to show this briefly, explain the context a bit more, and the model concludes, if someone has just been arrested and is facing very serious allegations, a cautious, tightly controlled, memory-limited style of answering can look more like stress management than concealment. In this transcript, she's not refusing to engage. She repeatedly answers the questions, accepts corrections, and gives the core sequence of events in a consistent way, while also qualifying what she can and cannot remember. That is visible in passages where she says things like she cannot remember specific details, but still gives the broad narrative and the reasons for her concern. So yes, the stressful context does add credit to her demeanour. It makes the combination of brevity, hedging and restraint look less like evasiveness and more like a person under pressure trying to answer carefully. The transcript still shows her being directly responsive. She identifies the timing, describes the baby's deterioration, and explains her concern about the long line and fluids. And as you can see, the scores have been revised upwards somewhat. So I thought that'd be an interesting exercise. I know people are sceptical about these models, and they are limited to a certain extent. What I will say is that they are geniuses with language. Unless you are an absolute genius with language, then you're not going to be better than this learning language model. It's just not feasible. Where they struggle is with human context. So some of that needs to be provided. But the bottom line ultimately is that Cheshire Police should have been able to see that Lucy was being transparent, compliant and cooperative, and that this is consistent with an innocent person. So we'll see what happens now in 2019 and 2020. So this is Lucy's second arrest in June 2019. It's now 4 years since these events took place. Okay, the first baby I'm going to talk to you about is baby A. Do you agree, Lucy, that it was actually you who noticed the colour changing to baby A? I noticed the colour change, yes. Okay, again, was it you, Lucy, who connected the fluids to baby A? No, from my memory, it was Mel. And then in summary, Miss Letby was asked whether she was standing or stood by baby A's incubator when she collapsed. She replied, I was stood by the incubator carrying out my checks. Were you stood by his incubator when the monitor sounded? I don't recall exactly when his monitor sounded. If I was stood at his cot side, then yes, I would have heard the monitor. I agree I was stood by the incubator checking, carrying out my checks, as I said before. But you don't remember the alarm sounding? I don't remember specifically, no. It was a long time ago. I don't remember what monitor went off and when. Okay, but do you remember, you think that it was Nurse Taylor who connected the fluids then? Yes, but that is only from my memory. It's a long time ago, yeah. No, I agree, as in the fluids, she did sit at the computer writing her notes while I was checking the fluids and everything else. Is it at that point, Lucy, that you have caused harm to baby A? No. Is it at that point, Lucy, that you have murdered baby A? No. Lucy Letby was informed of the expert's view concerning air embolus, and she replied, well, I don't know how he would have received a bolus of air. From which line? Does it say which line? How would that be of significance, Lucy? Because whoever did connect the fluids, either myself or Mel, they were connecting via a long line. It would be very hard to push air through a long line. See, you do know a little bit about it then, about air. I know how you flush fluids through a long line, and it's a hard pressure to push through. I don't know how you'd push air through a long line. So, are you saying that this was an accident then, Lucy? No. I'm saying that I don't know how that occurred, but I did not do anything deliberately. And yes, they've quoted me being stood at the incubator, but that does not mean that I was doing anything untoward to baby A. Was anyone else next to you by that incubator when the alarm sounded and stuff? From memory, Registrar Harkness was in the room at all times. He was with baby B, and Caroline Benyon, another nurse, from memory, was in and out of the room. We know that to be correct. So you remember that? From memory, yes. But you don't remember about the line. So you remember that line, but you don't remember other issues about that particular collapse, do you? No. Did you deliberately inject air to baby A? No, I did not. Did you see anyone else cause harm to baby A? No. Do you have any explanation, Lucy, for baby A's collapse? No. My concern at the time with baby A was whether there had potentially been an issue with either the fluids or the line, because it was so quickly after the fluids had been connected that there was a problem. I know I had asked for all the fluids to be kept, for the bag at the end to be checked. I don't know whether that was done or not. Do you know can you tell me about air embolisms? I don't know a lot about air embolisms. I know when we're priming lines, we're always taught to prime the lines fully to make sure that the lines don't have any air in them, because that would be dangerous to the patient. But when were you taught that, Lucy? When I very first started doing fluids, when I started on the unit. Do you remember who told you that? Not specifically, no. Right, but that's something you clearly knew, you were aware of. Yes, it's something that all nursing staff were very meticulous about checking the lines. And you'd be aware of the consequences of getting that wrong, wouldn't you? Yeah, I think all nursing staff would be aware of that. And what are the dangers, Lucy? Well, I don't know what it would cause, but you don't want air going into the bloodstream. Why? Because that's just not where air would go. It's not the natural pathological, probably she would have said location of where air would be. And what are the consequences then if air was in the bloodstream? I'm not sure. Would it affect the baby's perfusion? I don't know exactly how it would affect the baby. So that's the end of the interview for 2019. Obviously, they're making serious allegations against Lucy and asking her some serious questions at this point. I would still say she was very compliant and very helpful there, answered all the questions reasonably, made some very fair points. I'll just read through the 2020 interview and then we'll conclude. So this took place on 10th of November 2020. It's now been 5.5 years since these events took place. Did you ever try pushing air through long lines, Lucy? No. Did you push air through baby A's peripheral line or his UVC? No. Is there any way that air could accidentally be inserted through the UVC? Not that I'm aware of, no. Would there be any visible changes to the skin, do you know? I'm not sure. Could you explain to me what internal effects this process would cause if there was air down the line? Yes, and had been administered into a neonate, like an air embolism and air embolism. Do you want to elaborate what that is for me then, Lucy? I don't know exactly what it is, but when we were taught about lines and things, that's the things we were taught of, that you clear the line and don't, make sure you haven't got any air in, because that's what it could lead to. And you were fully aware of that throughout your time on the neonatal unit. You were confident about that process. Yes. Lucy Letby was then informed of Professor Arthur's opinion, he having reviewed the radiographs and was asked, quote, "Is there anything you would like to say regarding that observation from Dr. Arthur, Lucy?" So let's just emphasise at this point that Dr. Arthur's research and what Dr. Arthur put in the court case and Dr. Arthur's so-called study that he's never published does not indicate that air was present deliberately. It never claims to do that. He never did that in court. It cannot be inferred from that. All that we know is air is present, but we know from his study that it can be present in lots of infants and is present in lots of infants. So Lucy just says, no, I can't explain how air got there. Lucy Letby was then informed of the opinions expressed by Dr. Evans and Dr. Manarides and asked, "Is there anything you wish to comment regarding this? I did not deliberately give him any air." Okay, Lucy, so we're going to talk to you about some social media and Facebook accounts, all right? DC Stephen Owens has the data retrieved from the download and has provided analysis for searches made through your Facebook account. Can you describe your relationship with the parents of baby A? There is no relationship with the parents. You have no relationship. There is no... Did you have any? Did you talk to them? Did you? A professional relationship? Professional. But nothing outside of the unit? No. Was that the case with all the parents? Of the babies in the inquiry? Yes, yes, yes. Did you have any contact with them outside of work, Lucy? No. How did you communicate with them if you needed to speak to them? It would either be in person on the unit or telephone calls. Any other means? No. And who instigated the contact? Would you instigate the communication? Well, it would be either way. It would be if the parent phoned the unit or came to the unit and asked a question, or if I had something that I needed to talk to the parents about. Did you use social media to research the parents, Lucy? I don't recall. You don't recall? No. I take it you remember having a Facebook account? Yes. Do you still have a Facebook account now, Lucy? No. Did you ever use Facebook to communicate with your friends and family? Yes. Did you use it to search for individuals? Yes, at times, yes. But you don't remember researching the parents and any of the babies? Not specifically, no. What device did you generally use when you were communicating with friends and family? With which device? With your Facebook account on, usually a phone or tablet. And where would these searches take place generally? Searches when you were searching for the friends and family. Oh, I don't know, anywhere at home or out. Did you friend request any of the parents of these babies at all, Lucy? Not that I remember, no. Did they contact you at all through Facebook? I can't remember. So from our records, Lucy, baby A was born on the 7th of June 2015 and died on the 8th of June 2015 on 4 attempts, 9th of June, 10th of June, 25th of June, and then 2nd of September 2015. You searched on your account for the name of the mother of baby A and B, which we know is the mother. Can you give any explanation for that? No. So I think it is a little bit regrettable that she said that. I mean, nothing is going to help her at this point, but she does go on to explain more. But, obviously what she should have said was, it's just natural concern because I was sad because the infant had passed away. But she does kind of mention this, but she shouldn't have said, can you give any explanation? No. But it's far too late for her at this point. Did you agree you made those searches on Facebook then? No, I've told you this. Yes. Yeah, if they're there, but I don't recall why that I've pursued it any further in terms of asking them to be friends or messaging them or anything like that. There were obviously 3 searches, Lucy, in June, pretty much after the birth, and obviously the death of baby A as well. Well, they're all after the death. When were you searching? What were you looking for? I'm not sure. I don't know that I was looking for anything. Okay, then the next search you did, the final search was in September the same year, 2015. Again, when you searched for the mother of baby A and B, what were you looking for on that occasion? To see how maybe baby B was doing. Okay, and why did you do that? Because we think about the babies on the unit at times, and we talk about them and wonder where they are now and what they're doing. Okay, what did you find when you did that search for baby B? I don't remember. Okay, do you recall what you saw? No. Did anybody else know that you did that search for baby B? No. Okay, so you said that on that one for September, you think potentially you were looking for baby B. What about the ones you did in June then? I don't know. Okay. Did the mum know you were looking for updates on baby B? No. Okay, so it was nearly 6 weeks after baby B had been discharged from the hospital, and you were still looking to see how she was getting on. Is that correct? The 2nd of September 2015. Yes, if that's the date, yeah. Thank you. So I'm not sure too sure what to say about that, because we've dealt with the Facebook searches so many times. It really is a perfectly natural thing for a nurse to do. You know, she said she's concerned about baby B, a very natural thing for a nurse after the passing of baby A, particularly if she'd been involved briefly with that infant. So the police have obviously, as we know, attached some enormous significance to this and some nefarious context. But I just don't see that's justified. It clearly isn't justified, frankly. So I think all that remains for me to say is to go over the themes that are evident from this interview. The first thing is that Lucy's account correlates with the expert panel and is consistent with the established record of events on the unit. Lucy is clearly cooperative throughout the interview. There is no indication of deceit or lying. There is no indication of evasiveness or avoiding questions. Simple question, what was Lucy's solicitor doing? She seemed to receive very poor advice and counsel, as evidenced by the fact that she just sat there answering question after question after question with no advice or interruption from a solicitor. With this in mind, the implication made in the Netflix documentary that Lucy answered lots of questions by stating no comment couldn't be further from the truth. Indeed, it would have been better for her had she done this. Lucy even introduces the infamous handover sheet into the conversation, surely giving clear indication, even to the immensely credulous, that these were items of no significance to her. It is clear that comments made by Danielle Stonier about Lucy pausing are even more stupid than they initially appeared. There is nothing remotely suspicious about anything that she conveys here, and Stonier's interpretation is bordering on brain dead. There is no indication that Cheshire Police understand the case, not least because there are multiple people in the room for this infant, as is accepted by all parties. The logistics are completely implausible, impossible even. It's not clear why this isn't a red flag for the police or even the jury. So the last thing that I'd like to discuss in this video is how things went so spectacularly wrong in the police investigation and the whole process of Operation Hummingbird. Now, in the YouTube video that they released, we see various so-called analysts related to Cheshire Police who work for Cheshire Police talking about how they were seeking patterns, how they were looking for patterns. And this is related to a human tendency that, this is not a commonly known word, apophenia, but I think the human tendency to look for patterns is well known. So I'll just read this out. This is from Psychology Today. We want to connect the dots even when information or data are completely unrelated or random. When meaningless things are significant, existence feels special. Apophenia is a broad concept involving pattern perception in anything from the sequence of numbers in lottery wins to a pattern in statistical data. So I've often cited this idea of if the lottery balls came out 1, 2, 3, 4, 5, 6, people would think that was very strange. Of course, it's not strange. It's no more or less likely than any other result. Earlier descriptions of apophenia, also called patternicity, appeared in the literature in the 1950s by the German psychiatrist and neurologist Klaus Conrad. The term is the Greek apo for away and phenia for display. Conrad described apophenia in psychotic patients who had perceptual distortions. Apophenia is not a disorder or a mental illness, it is a normal and common human experience. We want the patterns we see to fit together. This gives the universe order and a feeling of comfort. We prefer things to happen for a reason. Ambiguity can bring uncertainty and anxiety. The brain itself is geared for pattern recognition, looking for structure and organisation out of chaos and randomness. Spotting a pattern is a basic survival mechanism. Don't eat the plant with the dots, it will kill you. So we can see here many of the issues that plagued Cheshire Police, but I think there were other aspects of cognitive bias as well. In particular, confirmation bias, the tendency to process information by looking for or interpreting information that is consistent with their existing beliefs. You heard Dr. Steve Watts talk about this, or most of you will have done, hopefully, in the recent second part of the Botched documentary. I also want to talk about the Ash conformity experiment. So this was a series of studies directed by Solomon Ash, studying if and how individuals yielded to or defied a majority group and the effect of such influences on beliefs and opinions. Now, you may not be surprised to learn that this had an enormous impact. Many early studies in social psychology were adaptations of earlier work on suggestibility, whereby researchers such as Edward L. Thorndike were able to shift the preference of adult subjects towards majority or expert opinion. Still, the question remained as to whether subject opinions were actually able to be changed, or if such experiments were simply documenting a Hawthorne effect in which participants simply gave researchers the answers they wanted to hear. In 1951, Ash conducted his first conformity laboratory experiments at Swarthmore College, laying the foundation for his remaining conformity studies. The experiment was published on 2 occasions. In the control group, I won't go over the whole experiment, but I just wanted to show you the results. In the control group, with no pressure to conform to actors, the error rate on the critical stimuli was less than 0.7%. In the actor condition also, the majority of participants' responses remained correct, but a sizable minority of responses confirmed to the actor's incorrect answer, 35.7%. So it increased by an extraordinary amount, 50 times the control group. The responses revealed individual differences. 12% of participants followed the group in nearly all of the tests. 26% of the sample consistently defied majority opinion, with the rest conforming on some trials. An examination of all critical trials in the experimental group revealed that 1/3 of all responses were incorrect. These incorrect responses often matched the incorrect response of the majority group. Overall, 74% of participants gave at least one incorrect answer out of the 12 critical trials. Regarding the study results, Ash stated that intelligent, well-meaning young people are willing to call white black is a matter of concern. So if you can see here, in the control group, it was less than 1%, and across all the critical trials, 3/4 of the group gave one incorrect answer. Now, we can't say that was all due to the pressure of conformity, but clearly that's had a massive impact. So I think that's very significant in the Cheshire Constabulary investigation. And I wonder, and I've wondered numerous times, whether or not there were any dissenting voices. I suspect that there weren't, from what we've heard. Whether they would have been drowned out anyway, we don't know, but it seems to me that there was no dissent, and they just set off on this highly regrettable path and couldn't understand their own cognitive biases. Another potential cognitive bias here is that the police are constantly surrounded by crime, so they can start to see everything as a crime. Another cognitive bias is that I do believe very strongly that the police became overly excited about doing this massive case, and then they wanted to continue, and then they started to see everything as confirming that process. So if you put all of these biases together, apophenia, confirmation bias, the, to be generous, mediocre ability intellectually of those that we've seen prominently working on the investigation. So Paul Hughes, Blackwell, Simon Blackwell, isn't it? And Daniel Stonier. I think we're being generous to describe them as mediocre. I did, during the botched investigation, I was watching it and Paul Hughes said something, and I was watching it on my own, sitting on my own. I don't often speak out loud when I'm on my own. I just went, God, you're so thick. And it was a completely involuntary reaction. I just couldn't believe. Even though I'm used to him, I just think, stupidity is always kind of surprising to me. He just is thick. I think he's below average intelligence. But when you put all these things together, and then you have group conformity, then you have a kind of compelling reason for everyone to think the same way. What you end up with is a calamity that's happened here. You could say, well, it's people of higher level of ability, that the same thing pretty much applies to what occurred with the consultants, where they had confirmation bias, they had a self-serving perspective, there was a group conformity, and things just catapulted out of control, as occurred across the Lucy Letby case. But in conclusion, we can see from looking at these police interviews of Lucy Letby with regard to child A, that she did her absolute best to be cooperative. She did her absolute best to give accurate information. And somehow, because of all these issues and all these problems and all these weaknesses and deficiencies at Cheshire Police, they were unable to see that Lucy was only trying to assist them and that they had an innocent person in front of them. I hope that you've enjoyed watching this video. If you haven't subscribed to the channel already, that always helps me. So if you could subscribe and you haven't previously, then that would be very much appreciated. With that being said, I hope you've enjoyed watching, and I'll look forward to reading your comments as always.